And welcome back, everybody, to the Rejuvenating Healer section, where it's sponsored by Cultivate Self. And today we have a great treat for you all. We're coming back here with Dr. Manmeet, Rattu, and also Diana. And we have a special guest here also, which is Indy, also from Cultivate Self. We had a really awesome weekend, long weekend at a Sedona.
Would you say it was neuroplastic? Would you say it was neuroplastic?
Yes, very neuroplastic. And so I'm very excited to be able to kind of summarize and let everybody share kind of the experience in the trauma conscious yoga training that both Diana and Dr. Manmeet did over there. So without ado, would you guys like to introduce and say hi?
Wait, I got a pitch there. It'd be cool what if Diana introduced Dr. Manmeet and Dr. Manmeet introduced Diana?
Oh yeah, I could do that.
Okay.
Wait, are we recording still? We're still recording. So just go for it.
Okay. Well, so Dr. Minnie, she goes by Dr. Minnie as well. And she is a licensed clinical psychologist, specialty working with trauma in many different communities. All from we have so many. I don't even know where to start. Incarcerated folks to domestic violence survivors. So you have quite the background and expertise in the field of trauma. So I was just super excited to collaborate with you on this. And Minnie also is not only an expert in trauma and PTSD, she weaves in CBT, cognitive behavioral therapy, and also yoga therapy, which is why this training in particular was so very special, because we got to learn about how she's integrating yoga with her patient or with her clients and patients, and how she brings that lens of yoga philosophy and all of the benefits and the scientific evidence behind the benefits of yoga for mental health. So it was really exciting. So I guess, there's so much more I could say about her. She's really fun. She's a fitness bodybuilder, and she really knows how to work the stage. So being on stage next to her was good for me. I got to learn a lot about like posing and flexing and all of that. We did flex a little bit. I saw her flexing a little while she was up there. She can't help it. And so
during the classical dancing, you mean?
Yes, exactly.
Funny.
So that's a little bit about Dr. Minnie. Yeah.
Thanks, Dee.
Yeah.
Lovely introduction. It's always interesting to hear from your friends or people that you work with, like how do they see you? What do they remember about you? So that's great. Thank you. Mm-hmm. So Diana here, Lady Di, is a registered nurse. She's has a lot of experience working in pediatric population. She was a pediatric ICU nurse at Oakland Children's Hospital, where she learned a lot about trauma and stress, which again, it was really great collaborating with you, because you have a lot of experience, a lot of expertise, not only with the patients that you worked with, but also within the nursing team. And so Diana also has a big interest in helping other nurses. She's created this nonprofit, Cultivating Self, which platform we're on today, which is really incredible. And they're doing a lot of great work here in California and also in Hawaii now, and hopefully other places in the future. But her heart is just so open, and I think you're just a very caring and loving, genuine human being. And it's not just in your work, it's personally, you are who you are. You just shine everywhere that you go. And now you're also transitioning into doing health coaching, right? Nursing health coaching as a holistic health nurse. And so she'll be seeing clients that are interested in getting coaching regarding patient advocacy type of work. And, she can help patients learn more about their diagnoses and the mental health that they're experiencing, or just the physical health symptoms, going over their charts if they need help with that. So a lot of experience, a lot of great, insight that you can bring, I think, as a coach too. We just recently did this incredible training together, which was so fun. It was 4 days. It was, it just aligned so well. I just felt like it just flowed really great between our lecture and didactics and the experiential practices that we had. We had some volunteers, faculty that came in and did some of the training with us, including yin yoga. We did Indian classical dancing. We had some talks and other series that were included in the 4-day, 20-hour training. And the attendees that were Yoga Alliance certified were able to get 20 hours of CEs, which was really exciting for our attendees and even for us. I think it was really inspirational just to see where else we can take it. We're still awaiting feedback and evaluation from the people that attended. So I'm really excited to work with you more, Diana. We're going to be doing a lot more of this. We've been already thinking about how to bring that back here to San Diego, where we're both at currently, but then also spreading, across the state and other regions. So possibly Hawaii and other countries too. We want to go international, go to retreats and anywhere that people are interested in learning more about trauma, stress, from a biological perspective, psychological perspective, pure spiritual perspective. And I think we did a really great job. I was really proud of how it turned out. And yeah, I'm just really excited. And Indy, of course, you were there too as part of our training, and Charlie, Indy helped with did the laughter yoga, be a part of it, which was really fun.
Oh, not laughter yoga. That's a copyright. So
oh, neuroplasticity.
Remember, yoga it can be copyrighted these days, right?
Oh
So
my
you have to
gosh,
be
that's
careful.
great. Yeah.
So what did you call it? Wasn't it? Well, I don't know.
Neuroplasticity.
That's just
Neuroplasticity. Whatever.
Okay.
Somebody asked
well,
me. Somebody asked me
it
the other
was
day, they're like,
fun
"Are you a
having
surgeon?"
you.
I'm like, "No, I am a surgeon. I'm a surgeon for your psyche."
Yeah, so it was another really great intervention, I would say, when it comes to managing stress, trauma, and learning to work with whatever it is that we need. And Charlie helped a lot with the camera and getting footage, and also getting some interviews post training from some of the attendees, and they were able to give a little feedback, and which was really great too. So yeah.
Yeah, and thank you both, Charlie and Indy. Just want to honor both of you for showing up. First of all, we wouldn't even be here if it wasn't for Indy, actually even pitching us to begin with for this training. And so that was really quite a blessing to get the nudge and the encouragement to, this is something we've been talking about and kind of visualizing already. And it was really a good opportunity to bring it forth and to really actually, I joke about it, but it's true about Minnie and I have been conceiving together for the last few months and we finally gave birth. And so to really birth this baby together and what it and how many people it really served and helped. And so thank you, Indy, Rishi, and Charlie for your support. And also Charlie was there giving us like some body work while we were.
Oh, that's right. Yeah.
Oh my gosh, that was so helpful and supportive to receive that. It was a good reminder of like how important it is to have strong teams when we're doing this work, and that we can't do it alone. So
great.
So just big time. Wow, nice. Got some video
Yeah,
there.
thank you for acknowledging that. I mean, I would like to also, highlight how challenging it was to get this to get it to the place where it happened, right? And for you two to be the ones to make sure it happened, it comes from a place that is integrative, where people are actually practicing they're themselves. A lot of times, a lot of people who do these like certification programs and training programs, especially around trauma, they haven't reconciled their own trauma. Like they haven't transformed and transmuted their own trauma. So they end up just projecting it on the people they're certifying, which is a pattern actually, which was really tough. I don't know if you guys know this, but it was tough for you guys to end up with this opportunity because there was a lot of resistance with having people who are not traditional, But you guys you're a doctor and you're a nurse, and you guys are the most traditional you could get. Yet it was difficult because there's people who are in the DEI space, who are in these spaces, who are making it actually more toxic to do this work. So I wonder if you guys can reflect like how it was to do this and create this. Like, was it challenging? And any what were some of the challenges in that?
Yeah, I really appreciate that insight, because I do really think it's valuable and important for us as teachers, as facilitators, to be doing the work ourselves. If we're not doing it, it does come across, and your clients, your patients, your students, they will pick up on it. And it really creates a disconnect from the service that you're providing, So this 4-day workshop, if I'm teaching skills and advocating for certain recommendations and in everything that I'm stating, it's coming from my own lived experience. So, I was able to disclose a little bit of my own history, my own trauma, not to pour it on people, but to normalize the experience that we're all experiencing stress, we're all experiencing trauma at some point or another, but we also have these types of spaces to come together in community and to help support one another to heal. And there is resiliency in that. And I was in tears for quite a bit, in the first day, because I got really emotional as I was sharing that, not because I was sad about, trauma, but more about like this resiliency. It's so beautiful that we can go through difficult situations, and I'm not, just because I'm teaching these things doesn't mean that I'm not subject to trauma myself, or that I don't experience stress myself. So I think that really helped the group to feel safe and to feel connected. And I noticed that most people that attended were able to go deep quite a bit. I was really surprised at how deep some of these people went. And I was so proud of them, how they felt safe enough to share personal things and to share tears and get emotional, and everybody was able to connect and hold space, even though it was a large group. I think there was about 60 people in the group, but if somebody was sharing, you just felt the cohesiveness in the group. And so I was really proud of that. And I 100% agree. If the facilitators are not doing the work themselves, it just doesn't feel safe. And especially when you're talking about something so vulnerable like trauma, and I take it very seriously. It's the work that I do, and it's, I talk to people one-on-one, and I'm very engaged in it. So it's not just a written theory that I'm just reading about. When you're in it, you have to have that type of level of support in order to help people heal. So it's just yeah, so I thought it went really well because of that. Diana too, right?
Yeah, I was that was one of the things I think in terms of challenges, Rishi, to answer your question, like when we found out how many people were going to be there, I mean, because I think Minnie and I were thinking, okay, maybe like 20, 30, 40 people max or something. And then, to get such a great turnout, as grateful as we were also like, okay, how do we create this container that of safety, of love, that allows also, that's a container but that also allows flexibility for people to move through. And so it was really, we named it, and we recognized that that was our intention, and it just happened. Like, we just created it. It was nothing that we practiced or even talked really about further than that. It was just this awareness of needing to do that. And it was just really beautiful how we were able to, and it came through with the feedback. And so I'm really happy about that. And I mean, that was one of the things that touched my heart the most, and also allowed for us to go, all of us to go really deep, and for people to feel, because most of these participants are already, they're doing the work already. Like, they are in their community, out there working with communities that have been impacted by severe trauma, themselves have come from trauma, and they're also healers themselves, whether they're therapists or counselors, doctors, yogis, nurses. So all of them are already on this path doing the work. And so they were, so this was not their first trauma training or course by any means. A lot of them actually have quite a bit of extensive backgrounds in this work. And so that, and we didn't know that, but it was just that, actually learning about that, and then also seeing how impacted they were in such a positive way, you know, with having all of that background, that really really confirmed and really showed us that we were doing something doing something special, that's not really done. And you know, Minnie and I have been in a lot of trauma trainings ourselves, and I've never been in a training like this before, you know, and so we really did want to create something special and different and heart centered, where people could feel it, could feel safe, could feel connected, and feel that they also had tools and they were empowered to bring it back into their communities. And so it, you know, based on what we've heard, it seems like we did that. And I know that there's always room for growth, and so we, you know, are going to continue fine tuning um, and really honing this practice to make sure that everyone that participates in our future trainings has a tremendous experience and feels supported.
Well, question on that one.
Sure.
What is so different about this training? Like, what did you guys learn that makes this something that would be helpful to nurses, to doctors, to psychologists? I mean, with the incidence of mental health and mental unwell-being, unhealth happening, it's so prevalent in our country. The Surgeon General just announced that, you know, this is a real mental illness, is a really big problem in the United States, and loneliness epidemic is going on. So what did you guys identify clearly how this training can specifically help people who are caregivers or who are showing up in their communities and facing trauma in their communities?
Minnie, do you want to go, and then I can respond after?
Sure. Well, one thing is that, you know, this training really was able to hone in on all the multiple, it's multidimensional trauma. It's not only physical, it's not only psychological, it's not only spiritual, it's all of those things. And we were able to share all of that in one training. Usually, you know, when you go to, you know, in other trainings that I've been to, it's been split. You know, I might go to one training where it's specifically only about the psychological trauma, and it's only about the individual trauma. We were able to talk about not only individual trauma, but also systemic trauma. And so we talked about historical oppression and historical trauma, ancestral trauma, intergenerational traumas and wounds that we carry, and that we all are carrying a lot of these things. And if we're not aware of it, we're not going to be able to process it and to heal through it. And so that's where the spiritual component also comes in. So it's not only psychological, there's also the spiritual component that we need to be aware of, you know, the meaning that we create from it, the purpose, and you know, how we are energetically connected as well, that we as a collective do impact one another individually and collectively. And then also the physical piece of it too, that there are physical manifestations of holding on to stress and trauma. And we know this, it's something that we don't know in the science community, but you know, it's I feel like it's been so separated the way it's been discussed. But here we were able to safely talk about all of it, and it didn't have to feel like science versus spirituality. We were able to really clearly see and identify that it's both, and they're intertwined, and that's an old paradigm to say that it's either science or it's spirituality. Now we have evidence, we have you know, it's there's so much research. We're living in a really exciting time where we can actually see these things, what's happening in your brain and in your body, in your nervous system, when you're experiencing stress and trauma, even ancestral trauma, how it's being carried in our DNA. Like there's been more evidence of how even memories are being transferred through our DNA. So it's just, I thought it you know, it was very different for that. And then the other thing was like how we were sharing earlier, that the group itself was very cohesive, and we were able to have discussions, and it felt like one big solid group, that everybody was kind of coming from different places, but felt safe enough to share their perspective. And so I thought that made it really different. It wasn't just all psychologists, it wasn't just medical doctors, it wasn't just yoga students or instructors, it was everybody together. And we were able to have this discussion and see that we have to address, you know, psychological wounds and trauma, stress, all of these things from different perspectives, and all in the same discussion, that it can't be separate anymore.
Yeah, and then to piggyback on that, I think what the magic sauce was for us was the ability to bring in these practitioners and highlight their practices and how they're sharing their medicine and what has literally been medicine for their own traumas, and how they're sharing that in their communities, and whether it was the Indian classical dance, whether it was the bhakti yoga that we did for 2 hours that had everybody in tears, or I mean, or your neuroplasticity workshops that, and they were experiential. And that is such a huge piece in learning and carrying on. I mean, especially for me, and I know that I'm not alone, that I need to experience things. I can't sit in there. I don't learn by just listening to someone lecture at me. That's a piece of learning, but to really experience something and have a profound transformation within that, it's there's nothing like it. And so there was many moments like that, thanks to these practitioners that were the presenters that were there already, presenting at the festival, who we invited in. Dr. Sundar actually did not make it. We had Arundhati, and she came, and Arundhati shared pranayama with us. And that was really beautiful. She shared some really great techniques on how to regulate the nervous system through breath. And Reggie came. He spoke about this beginner's mind aspect, and how important that is with our healing journeys. Alan Alcid came, and he actually shared a yin practice with us. So it wasn't a training on yin. It was just an actual yin practice that people got to experience. And then Neelanjara, she came and did the Indian classical dance. She's an Odissi temple dancer. And then Sol David Ray and Dr. Manoj came to share the Bhakti experience. And then we know Indy came with his neuroplasticity. So the combination, and we spread it out, so we sprinkled it throughout the whole training. So it was nice. We had we were just breaking it up as much as possible. So it seemed to be that was really the magic of the training, really, is keeping people excited about new things. We kind of get bored seeing the same thing and hearing the same voices over and over. And so I think that was really, really powerful.
And what was the range of people that attended? Because you were at Yoga Fest, so I'm sure there's a particular, but like, did you guys see like a nice range of people that appreciated kind of these certifications?
Yeah, I think that there were a couple of correctional officers. There were some psychologists. There were doctors, a lot of yoga instructors, and what else did we have, Diana?
There was a couple of nurses. There were some counselors, like community counselors. A lot of people who, I mean, even among the yoga instructors that were there, a lot of them are offering free yoga to their community and doing a lot of this, you know, really trying to make yoga accessible to people who otherwise wouldn't have access. So right there already, they're already kind of just in the right mindset of like yeah, it was just already setting the right tone. And I think, yeah, I think that kind of was the majority. There was some, a couple people in like the DEI corporate spaces as well, who were showing up, and also yeah, that's kind of the gist of it, I think. But quite a range. I mean, we had a few men participating, which was great. We had a BIPOC community representing, which was great. And it was also nice that Sedona Yoga Festival offered some scholarships to participate as well. So that was really, really beautiful, because a couple of participants that even came up to me and said, if it wasn't for the scholarship, I wouldn't be able to have come to be here. So so that was really, really profound, and we felt it.
Yeah, and I think what was what was also really beautiful was that everyone was intellectually interested in the intellect of everything that we're discussing. It wasn't just like even though it was a yoga festival, I think that's kind of honestly, I felt like it was more of a conference. I feel like we should even call it a conference instead. That might even draw more people in. Because I was even hesitant to start or to even participate at first because it was a festival, and it just seemed like, a lot of people that go to festivals aren't as interested in learning about the integrity of the work that we're providing. It's more just for entertainment or whatever, which is fine, that has its own space. But this was really, people were really interested in education and learning and integrity and learning to support each other. And then also they each committed to practicing this karma yoga back home, like to take the work with them and committed, in their own way of how am I going to continue to share this work back in my own community. And that wasn't anything that we specifically made them do or asked them to do. It wasn't like a homework assignment, but it was something that came up when we were just sharing how the importance of karma yoga. We did a module on it. And so people started sharing in their own way, like this is I feel like now that I understand this, now that I'm educated on it, well, I also have a responsibility to contribute and to share what I'm learning with others in my own community. And people flew in from all over the United States, which I was also surprised to see. It wasn't just locals, there were people from all over that came and attended from across.
I got a question related to the Karma yoga aspect, because some folks might not know what that means, or karma like has a lot of there's a lot of misconceptions around that too. But also I'm curious how going forward if you guys, especially with Dr. Minnie, your perspective, the clinical perspective, and D as well, like how could karma yoga be beneficial right now for what's happening, for a lot of the trauma, a lot of the collective trauma that people are experiencing, and the separation that people are feeling, disconnection from each other? How does karma yoga play into that?
I mean, that's exactly it, exactly what you said, that this is a collective experience. So community is something that we talked a lot about, that we have to bring this back into our community. We can't heal as an individual. Right now, the old paradigm, the psychotherapy, most of it is just the clinician and the client in one-on-one talk therapy. But karma yoga is also collective healing. So tribal practices. One of the sessions that we attended at the festival was this drumming circle, which I thought was really incredible. That it wasn't just for, again, entertainment where we're learning how to play drums together. That was fun, but it was really that he was able to really share the integrity of what the practice of drumming and drumming in a circle, and how it's that we need to bring this sisterhood and brotherhood back together in community and sit in circles. And when I was drumming, I know, like, it was so hot. It was like 3 o'clock in the afternoon and the heat was shining and there was no shade. And there were times I kind of wanted to like stop drumming, but then I looked around and I saw everyone else is working so hard, and it made me want to continue. And it also made me think, like, if I stop, is it going to mess up the beat? That I have a responsibility to, even when it's hard, to contribute. And that's also what makes the beauty of the music, the drumming. And it was such a healing and beautiful experience that I personally had during that circle. And so, doing more things like that are going back to our roots and our cultures, and bringing even your own culture back into your community. Because right now it's there was also a module we did on how it's the Western paradigm. It's very like, that gold standard. And Diana, maybe you can talk more about that, but how it's just like psychotherapy and pharmacology. But now we're realizing we need to go back to healing in circles and communities where we're able to share. And it's not only through talk therapy, it's also through music, through dance, through the things that they were able to practice, the yoga, and our attendees got to experience all of that as a group. And so they were able to benefit from that through our experience over the 4 days. And hopefully they can take a piece of that back again home, you know, whether it, as a psychologist, they can do this in groups, you know, we have group therapy already. That's an opportunity. That's where I've been able to practice it in the past, doing meditations in circles or teaching yoga in hospitals, things like that. But if there's anything else that they were able to take from the training that, you know, that resonates with them, that feels like it's aligned with them, not something that doesn't feel like it's not for them or something that they don't feel comfortable with. But there was so much that I'm sure that there was some piece that each person could take back into their own home community, whether it's at their work or in their own yoga studio or in their own personal life, in some way that they'll be able to share a piece of what they got.
Yeah, absolutely. And I think for if we're talking also just about, you know, karma yoga and what that means, you know, if it really that just means, you know, being of service without being attached to any sort of outcome and being rewarded in some way or even acknowledged, really, but just being of service to be of service to. And so if we were bringing that lens to healing for all of us, you know, they have studied this as well, right? That when you are helping someone else, it's actually makes it easier for you, and you, there's parts of the brain that, you know, you can just like rewire the brain to then when you're not really actually so focused on your own trauma, on your own things going on, because then you actually realize that you have something to give, that no matter how depleted, how depressed, how low you feel, when you can when you can show up and be of service to someone else who might have it much worse than you, or worse is relative, but might be in just a different situation than you, that is a shift right there, because then all of a sudden you can be connected to purpose, you can be connected to meaning, and even talking about this loneliness epidemic that we're facing here, you know, I wonder how much of that loneliness is really connected, is really as a result of us being disconnected from our purpose. And so I think that it's really important to have spaces where we are volunteering, where we are being of service just for our own mental health, because it also brings perspective to our life. And so so I do think it's important, whether it's in the yoga space, you know, whether we're talking about karma yoga or just even volunteering and in your neighborhood, you know, if you have some sort of a skill to offer, to just show up, that it's important to bring that lens when we are talking about collective trauma, and just like what Minnie was saying, you know, if we're going back to our roots here, and what happened. I mean, I think I heard this story about some tribe, you know, in, I think some African tribe, where, you know, there was a gentleman who was struggling with mental health and depressed, and the medicine person said, here, go take care of this cow for the next you know, go take care of this cow for the next week, and then we'll see how you feel. And totally shifted, you know, he was taking care of this cow, he now had this sense of purpose, he now had was caring for something else outside of himself, like, and so I wonder what can this do for us, you know, have we even tapped in or explored the potential for what service can do for our own healing.
And I think what you're also talking about is altruism, right? I'm sorry, can you guys hear me?
Yeah.
Sounds okay. Okay.
Mm-hmm.
Yeah, I mean, what you're also talking about is altruism and compassion, right? And then there is a lot of research being done right now on what altruism does do to us, and it's not just about how when we're practicing altruism and being kind and helping and being of service, doing seva, it's not just for the recipient. We actually, as the person giving, benefit more. It helps to boost our immune system. It helps our sense of purpose and meaning. There's a lot of also physiological changes that happen when we're doing things for others. So we actually get more of a benefit than the person that you're giving to. when you're doing these things, which is incredible. You know, it helps us to be more socially engaged and socially connected, which is a biological imperative. So we actually need to do that in order to feel safe, in order to feel connected to our tribe. Not just to be in places where there's a lot of people, but where we're actually socially connected and doing things for one another.
Yeah, it makes me also imagine how sometimes, hopefully even people listening to this, that when you bring this trauma conscious training to your community, and you have Dr. Minnie there running it and Diana running it, collaborating and co-facilitating it, maybe there can be opportunities to bring people in the community who are doing work that are serving the marginalized communities, that are planting trees and planting food forests and community gardens, and that could be integrated into the trainings themselves, so that, you know, wherever this training is happening, it can also be infusing and inspiring people to give back in that community in a meaningful way.
Yeah.
Right. And seeing how different communities come together and use this service as healing, even if it's not entirely conscious, right? Like it is still healing in some way. So I love that idea.
Have you all thought about which communities you'd like to be able to bring this conscious yoga training to, right? Like, because I know there's a lot of communities that definitely need it. You know, are there some that experience a little bit more trauma than others that we could definitely kind of like say, hey, you know, how can we help your community get through trauma?
I would say, you know, being a nurse who was in the ICU for almost 8 years, and I would say absolutely 100%. I would love to bring this into hospitals. I would love to bring this to first responders. I would love to bring this to law enforcement. They don't get enough of this, if any. And so, you know, this was actually part of my work, and what I was fighting for when I left the hospital was more of this trauma informed training for staff. And it was just not a priority. It's just not ever in the budget. And so to me, that's unacceptable. And especially when we have the numbers, when we're looking at these like provider shortages and people and the rates of suicide among doctors and nurses and therapists. We really need to empower them with tools, with support, with community, with what we did in this training, so that they can feel that they are not alone, and that they actually have tools to continue showing up and actually sharing those tools with their community. So I would love to bring this to healthcare professionals and into clinics as well. You know, people who are working in the community. What do you think, Minnie?
Yeah, I agree with all of that. You know, yeah, hospitals definitely. I myself have worked in hospitals, and as we know, physicians now, ER physicians have the highest rate of suicide in of all the professions. Nurses, it's all increasing as well, and there's been, especially since COVID, you know, think about all of the trauma and stress that those communities, those nurses and doctors are healthcare professionals. So, and then also first responders, that's also been where my heart has been quite, you know, with our, not only police officers and doctors, but also veterans. You know, I'd really love to do more work for our veterans who, again, they are exposed to so much trauma, PTSD, stress, all of that. And they come back home and they don't even know that what it is. You know, I was working in a lab at Stanford for doing PTSD research. And when I was interviewing a lot of these veterans and asking them the assessment questions, trying to see, you know, the level of trauma they've experienced, a lot of what their symptoms, they just felt like that was normal, or they were abnormal for having the experience. So, you know, educating them on, you know, your body is actually responding in a very normal, appropriate way for the stressor or the traumatic situation. And here are, you know, so that once we're educated on what's happening, even for our first responders, when they're understanding what's happening to their nervous system, to their body, they have interventions to work with it right then and there in the moment while they're in the crisis situation. And then also having anchors throughout the day, throughout the week, you know, as a part of their daily practice, so that they are able to be more resilient to the demands of the stressors that are inevitable, because it's part of their job. It's not like they can just, you know, get rid of it or just like not think about it or avoid the situation altogether. Usually avoidance is most people's number one strategy when it comes to stress and trauma. But these people, this is their daily lived experience. So, you know, they have to learn how to cope and how to manage and how to still work with their body and work with their environment in a way that's optimal and still helpful, because we still need them.
Right. And also we have to think about how they're not the only ones that are impacted by this, but their families, right? We're talking loved ones, children. So this is a huge ripple effect that, you know, that we have talked to, you know, I have friends who are in law enforcement, and also even my friends who, you know, all of our friends that are healthcare providers, and the impact on the relationships, you know. So this is really really important to us and close to our hearts, that we really want to support the healthcare providers. That's why we are all part of this nonprofit as well. But at the end of the day, I really think that all communities can benefit from this training. I think that we, especially when we're talking about post COVID, which was a collective trauma that we all experienced together, and that we're still going through. I really believe that this could benefit, you know, everyone from engineers to, you know, grocery store workers. I mean, we're all in relationships. So how can we just prioritize trainings like this for the community and for the people who are showing up in this way?
Teachers.
Yes. Yes. Thank you, Rishi. Yes. I guess I always just kind of lumped teachers in with like nurses. I was just like, they're one and the same. Like their experiences just parallel each other all the time. So yes, 100% teachers, absolutely. I mean, and administrators too, right? I think, you know, when we look at these systems and the hierarchies, if one of my peeves, and something I was always trying to bring to the attention of the, you know, administration at the hospital where I was like, what are you guys doing to practice resilience, or, you know, to take care of yourself, self-care? What are you doing? And so it was always about trying to get the staff to do things, but really ignoring the fact that at the top nothing was being done. So you really do just then have this trickle down of trauma, and projection onto the staff. So it doesn't really matter what you do with them if the administrators aren't embodying and practicing as well.
On that note, I have to share, I one time was hired to do a neuroplasticity thing with the Hilton Foundation, which is a huge organization, Hilton, right? You guys know. And the VP was in that session. And after our neuroplasticity thing, I did like a meditation. And at the end of it, the next session, he opened up and cried. And that was the first time he had ever like opened up to the entire community about his struggles and his stuff. He had been putting up a front, and it was creating a whole, that what I got the feedback got later was there was all this misunderstandings and like class issues happening, and mismanagement and happening all throughout the thing, because everybody thought he was something else and he was projecting something else. And when he was actually vulnerable and he came and showed, everybody flowed more into compassion and more into understanding. And so this might be helpful to a lot of those folks up there too, that there may be there's a disconnection between reality and what's really happening.
That's
Yeah,
true.
and along the line, I'd say also like students, right? Because I think the students are also the next generation of those who we're going to be working with together, right? But they're not learning this from the get-go, right? They're already at disadvantage when they're going through any kind of, you know, life challenges. But we all know that we experience that quite a bit. So, excuse me. So, you know, COVID kind of made it tough for them because, you know, during a time when they're supposed to be social, like they were told everyone could be carrying something that could kill them. That's very traumatizing for children who, you know, or even, you know, I think high school kids and college kids today, I think are the most, you know, needed in this kind of learning, right? And being able to handle trauma.
Question
earlier
on
the better.
Yeah, earlier the better. And I got a question related to this because I wonder if folks, I get this experience when I bring up yoga and people get, you know, off, like it throws them in a direction that is not even traditionally yoga. Are you guys going to continue calling this trauma conscious yoga training, or is there another language you're going to use? Or what are your feelings and thoughts about that?
I mean, part of what the training does include a module on what yoga actually is, that it's not only asana, the physical postures that we go over, that it's the 8 limbs, and helping people to understand more of the entirety of yoga and its lifestyle practices. So I would want to continue educating people on that, so that they become more aware of what yoga actually is, and that there are some other practices that they can do. It doesn't mean you're doing a headstand that's yoga, or you could just learn, like we'd learn pranayama, that deep breathing, that's yoga. Meditation, that's yoga, but also karma, practicing, taking responsibilities. There's different ways to practice yoga. So I think it's an opportunity for us to educate more communities on what yoga actually is. And so we kind of did spend some time breaking it down on some of the myths and where the direction it's been going, and why it's important for us to kind of re-educate on what yoga actually is, and the roots of it. I don't know, Diana, what are your thoughts about that?
Yeah, I love that you said that, Minnie, because I agree. I think that, if we really come, and especially speaking to clinicians, and we can talk about yoga as a science, right? That yoga really is this template, and really a guide on how to live well, and how to be healthy, and how to have balance. And that's pretty much what we can, if we can start to look at it like that, and and not see it as this woo woo, or even religious, like associated with religion. And that's also another part of the conversation too, is breaking away from that, and recognizing that it is not a religion. um, I think that's even another great tool for people who aren't in the yoga world at all, to maybe they'll get curious about it, and now there's so many online, like free online resources and things that you can explore on your own. So I love that. I think it's great. And I'm also aware that there may be some spaces that, might be turned off with that verbiage. But to me, that's just an opportunity for us to have a conversation about it like this, and to really share, and inform, what the intention is behind that. And really, the great thing about this training is that it is pretty customizable. Like I mean, it's so rich. Minnie and I have talked about this, that each module can really be its own entire weekend workshop. Even like it could be even like a semester long, at the university level, if we really wanted to do that. So it's very rich. There's a lot that we can do, and it's really, I believe it's for everyone.
Yeah.
Cool. Well, did you guys want to let everybody know where, are you guys planning to do anything next? Do you guys have some plans for where this kind of develops to?
Well, we definitely have a lot of plans. We have lots of ideas, and lots of exciting connections that we've made. And actually, people have already reached out to us and invited us into their space, to do this training. So we're in talks with a couple of medical centers, and that are interested in bringing this, because they are acutely aware that they need to do more training around trauma, because clearly, whether it's been done or not, it's not working. It's not, they're not, the staff needs more support. They need more support. So Minnie, what do you think?
Yeah, I mean, we're open too. So like we said, because it can serve so many different communities, but we're definitely going to be doing more of this. It's exciting to me, this work, and the feedback that we got was really positive. So that's really encouraging, that people want to learn and people are interested. So we want to take this to different medical centers or universities, campuses, corporations, schools, wherever people would invite us. Really, would be open to have a discussion. And like Diana said, it's highly modifiable, because there's so much content there. It's 20 hours of content, but we have way more content. We couldn't even cover everything in that 20 hours, honestly. But we can even kind of curate it to serve the specific population that we're meeting that day.
Yeah, I love that. I think that's the beauty of this, is that we can create it to fit whatever the group is, whatever their needs are. We can make it work because there is so much. So please reach out to us. I think the best way to reach out to us is at cultivatingselfnow@gmail.com. That would be the best place to connect with us. If you're interested in this training and scheduling a call with us to see if this is a good fit for your community, please do reach out to us there, and we would love to support however we can.
Awesome. Thank you very much. Well, really excited for all of you guys to have shared this, and want to thank everyone for watching this kind of recap and summary of this amazing experience with both Dee and Dr. Manmeet. So thank you, everyone.
Wait, Dr. Minnie, can you give us one flex? Come on. Give us a flex over here. Let's see the flex. Come on.
I'm wearing long sleeve.
Come on. Oh, well, come on. See, she's modest too. She's modest too. That's a good yoga to do, to be modest.
Yeah. Well, thank you, Charlie and Indy, for being here to ask all the questions. So
that's great. Thank you guys.
Thank you so much.
Thank you.
We'll see you guys.